It's an honor to be a part of this program. It's so great that we're putting voice in amongst all this fundamental foundation work. So I'm honored to be a part of it. And I'm honored as a cisgender woman, pronouns she, her, to be an ally to the community. And I've been serving the community for 15 years, almost exclusively. I'm in New York City in private practice. Okay. This is I want to say, is, of course, just a little snapshot of what we do in voice and communication. So it may actually bring up more questions than answers, but I hope it at least fires you up into thinking more about this area and helping us provide this care. Okay. So why is voice and communication important? It's essential to life. Communication is essential for daily life, and it starts early. Voice is a significant form of gender expression and the embodiment of gender in terms of presenting in alignment with one's identity. It's really linked to our well-being when communicating with others. Think of how often we communicate with others in a single day. So having voice dysphoria and addressing vocal satisfaction with one's own, the way one sounds or communicates, and being able to be recognized in one's gender or expression or not be misgendered when talking to others. So there are 3 types of gender-affirming voice care: hormone therapy, phonosurgery, and voice training. So hormone therapy, HRT, does not make a significant impact on anything but pitch, and it doesn't make an impact on pitch raising, but it does make an impact on pitch lowering by about an octave. And there is a growing body of evidence that says that people are very satisfied with pitch lowering from testosterone, and I'm sure a lot of you know this or have experienced this. There is some dysphonia that can happen and can make a big difference for some clients. Dysphonia, not to be confused with dysphoria, means vocal health problem or voice disorder, okay? And we'll talk more about that later. Phonosurgery is the flip side. It's mostly pitch raising, mainly in the form of glottoplasty. A lot of improved satisfaction, vocal satisfaction with that as well, and some dysphonia. In terms of communications training, it's not just pitch. It's a wider array of ways of talking that are voice-related, speech-related, and communication-related. Again, we'll talk about that in a second. And it's not just techniques. It's mental strategies, how to integrate the voice with our sense of self. Again, the way we live in the world is very much linked to the way we communicate with others. So this is a very fundamental thing for a lot of people. So there is a growing body of evidence that there's improved satisfaction from training only and improved quality of life. Voice training is comprehensive for those who want a comprehensive change in their voice and communication. Voice training does do a number of things, not just pitch. It's reversible. There are no health complications if done well, and but there's a lot of commitment. It takes work. So a lot of folks will do a combination of voice training with T or voice training with phonosurgery, and that can be in different combinations. And WPATH recommends that that the client consider voice training as their form of intervention, either alone or with the other forms of intervention. Why? It's comprehensive, so there are more options. It's therapeutic. It helps with vocal health problems and maximize the results of the other forms. and it's mental, right? So there are all these things that voice training does. Now, not just that, but WPATH recommends, and this is, I really want you to hear this part, to refer to the speech pathologist for an assessment and intervention planning, no matter what, okay? We're kind of the primary care person for voice. I might get in trouble by saying it like that. Sorry, Erica, and the rest of you. But we help be the first in to think about the overall picture of voice and what are our options for voice change and vocal satisfaction, okay? So we're going to focus, I'm going to focus on the voice training aspect for the rest of the time. I'm going to give you some audio samples. 1 second. 54. Anyway, okay. So the rainbow passage is a snippet of a text that has been used in voice training for decades. And you're going to hear a number of people read the same passage. And at an initial consultation and some sessions later. This is to show both common and diverse voice patterns that can result from training alone, okay? So that each client has their own needs and goals. We won't have time to go into it. Each person has given me permission to share their audio samples. There's certainly no one perfect voice or one way to sound. It's just for you to get a snapshot. So I'm going to coordinate with Sean, one of our IT gurus. I start it and he stops it. So I might go, hey, Sean, stop. And this, I told a colleague this, that we were going to do it this way. And he says, oh, that means that you never know when to quit. And it's like, it's true. It's never, the good and bad parts that go along with that. So thank you for letting me show that in yet another way. Okay, 14-year-old trans boy on testosterone for 3 weeks. He wanted to have a more masculine sound to his voice and start that before the T kicked in, okay? So this is what he sounded like at the first session.
When the sunlight strikes raindrops in the air, they act as a prism and form a rainbow. The rainbow is a division of white light into many beautiful colors.
Great, thanks, Sean. And this is how he sounded after the 4th session without any change in pitch.
When the sunlight strikes raindrops in the air, they act as a prism and form a rainbow. The rainbow is a division of white light into many beautiful colors.
Great. Okay, next sample. 24-year-old trans man on T for 2 months. The pitch hasn't dropped yet from testosterone, wanted to get going on his voice. Initial consultation.
When the sunlight strikes raindrops in the air, they act as a prism and form a rainbow. The rainbow is a division of white light into many beautiful colors.
Great, and after the 6th session?
When the sunlight strikes raindrops in the air, they act as a prism and form a rainbow. The rainbow is a division of white light into many blue colors, beautiful
Again, only
colors.
maybe a half note of pitch drop. We're doing other things to change his voice. 23-year-old trans woman wanted the general goal of sounding more feminine. Initial consultation.
When the sunlight strikes raindrops in the air, they act as a prism and form a rainbow. The rainbow is a division of white light into many beautiful colors.
And after the 13th session of training only.
The rainbow passage. When the sunlight strikes raindrops in the air, they act as a prism and form a rainbow. The rainbow is a division of white light into many beautiful colors.
And the last sample, 27-year-old wanting to sound more feminine.
When the sunlight strikes raindrops in the air, they act as a prism and form a rainbow. The rainbow is a division of white light into many beautiful colors.
And after the fifth session.
When the sunlight strikes raindrops in the air, they act as a prism and a form of the rainbow. The rainbow is a division of white light into many beautiful colors.
I want to just, thanks, Sean. Awesome job. Making me look good. Okay, I want to say something about non-binary. I certainly have some non-binary samples there. They're just less of a change because of the person's goals, so it's harder for you to hear in this room, especially as non-voice professionals. Sorry, I didn't mean to. At least I got a laugh. Excellent. Okay, so you might want to take a look at this very important slide, and it shows all of the different things that we can target in training. The three main things we do is pitch, resonance, and intonation. And we're not going to have enough time to really explain all of this, but pitch we all know. Resonance is the tone of the voice, how big or small a person sounds. So I can change my resonance to sound a little brighter, like this, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Or I can change my resonance to be darker, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and I'm not changing my pitch. Intonation is about how to be expressive, and that's very important when you're thinking about how to be expressive in different contexts. The blue parts, amount of engagement and assertiveness, is really something that's been on my mind more and more in the last few years. It's really important in our role to help somebody engage more with the world and be assertive when they can. So it's it's about practicing and role playing and doing that work that you may be doing in a mental health session. But in the voice therapy room, we're actually working on those words. Okay. So we have a person-centered approach. It's not one size fits all. It's not even one size fits one, because we have different ways that we speak in different situations, or there are gender fluid folks who want to change from one time to the next. This has been discussed earlier today, and I'm just reiterating how we have to manage social expectations in the world. All of us do. We all have to deal with the binary. We all have to deal with stereotypes, and many of us have discrimination when we communicate, and some much, much more than others. But, women, trans women of color, et cetera, we all have to figure out how are we going to deal with this and be in this social framework. So as the speech pathologist, we're helping somebody find their individual voice within that social framework. Asking questions like, how do I want my expression and treatment to be different? How do I want to position myself in the world? Do I want to challenge concepts of gender, or do I want to fit in and have the way I'm talking not be noticeable in any way? How might my expression change across roles, work, home, neighbor, chess player, whatever it is that we're doing at the time? Not just the social framework, it's the physical framework, right? When you want to modify your voice and how you talk, how is that shaped physically in my body with the vocal instrument that I have? So what might that sound like? So we've got the limitations of society, and we have the limitations of the body. But there are so many options within that that are possible. And our work in voice is not fit people into cookie cutter roles, but to create voices that work for people, that are affirming, and that create diversity and hopefully create a broader sense of social acceptance. I can stop now, right? Okay, common complaints. How are we doing? Okay. So, complaints about voice that I might hear when somebody comes into my office. So, being misgendered, having stress as a trans person, a client may have may want to change a lot in how they're speaking, may just want to change a little. For a client whose goal is to be more feminine perceived, they may have a specific something in mind of what they don't like. It sounds too low, or it sounds too boomy, or it sounds too breathy when trying to speak more feminine like this, and people can't hear them. A client who has a goal of being more masculine perceived may be on T and has that, what some people refer to as that trans guy voice. And that usually means it's changed vocal cords and lowered pitch without anything else changing. And so it sometimes leads to people feeling or being told that they're young, or being perceived as younger than they are, or trying to speak low and being too quiet because I can't be heard because you're speaking too low, or too feminine when you're really expressive and it doesn't sound right to them. Another complaint is strain or vocal fatigue when trying to modify the voice on their own. The dysphonia around testosterone can be hoarseness or throat discomfort at the beginning of each dose, or at the first few months of testosterone. Strain, asthenia, that's weak voice, reduced range, or insufficient change can come from pitch raising surgery. It takes out the bottom, but doesn't necessarily open the top without training. And so someone may come in to see me only after surgery and want to just maximize their results and deal with those voice changes. Sometimes those changes don't bother a client, but sometimes it will make a difference. And training, of course, is useful when somebody doesn't want surgery, doesn't want testosterone, or wants to be on low dose T, particularly if you're a professional voice user, or if you're a young person and you're not able to go on T yet. Okay. Pretty good. So I'm going to...
When the sunlight strikes raindrops in the air.
I want to go... Oh, he's doing great. It was all me. Yeah, it's number 6 I want. So here's a sample of a specific complaint. This person was already using a feminine voice and complained that she couldn't be heard, and she had some vocal strain. So we worked on helping her be less breathy and less quiet, okay? So this is what she sounded like at the initial consultation.
When the sunlight strikes raindrops in the air, they act as a prism and form a rainbow. The rainbow is the division of white light into many beautiful colors.
Great, and after the third session.
When the sunlight strikes raindrops in the air, they act as a prism and form a rainbow. The rainbow is the division of white light into many beautiful colors.
So sometimes our work is not just, let's start from 0 and go to 100%, whatever that means, based on my thinking of what gender is. No, it can be a very specific complaint about what's happening with their voice. Okay? And this is what voice therapists do all the time. We just help modify and do it as quick as we can, and sometimes it's around gender and sometimes it isn't. Okay.
When the sunlight strikes raindrops in the air,
when the sunlight strikes raindrops in the air.
Ooh, you heard it. You heard how fabulous it was anyway. Okay. Okay. All right, so now let's just talk about what it looks like. I really want you to kind of get a sense of what is it that that we do. So a sample voice and communication training protocol, somebody comes in to the speech pathologist's office. This is what would happen in the first consultation that I hope that happens more and more. Coming in for that one assessment to help a person know what to expect with their voice, no matter what they choose in the future. So, case history, samples of what the voice sounds like baseline, so that samples can be taken later, right? So that only for me, I can show them at a conference. Overall profile of all the different aspects of speaking and that is being addressed or discussed, and be able to determine the goals that the person might have. It might only be a certain situation, or it might be more global. And then we talk about intervention options. So it's at that point that the speech therapist is saying, oh, this is what you can expect with T, or this is what you can expect with surgery, or this is what you can expect from training, and this is what you can expect with a combination. So it's really because we know all those different areas of the voice, we can get an overall picture and help the person understand how would those things apply to their particular situation. Sometimes a consultation involves video stroboscopy, which is a vocal fold imaging exam. Some speech pathologists do that, and sometimes it's the laryngologist. And we do that if there's a vocal dysphonia complaint. As I mentioned, how we move forward is person-centered. It's based on the values of the client, not about what I think they should do. When we work on technical skills, it's a lot of drill work. It's a little bit like a singing lesson. It's vocalizing, it's reading lists of sentences, it's talking in conversation. It's a lot of homework. It's maybe 15 to 30 minutes a day of practicing. Why? We're retraining the brain of a new habit. That doesn't necessarily erase if the person doesn't want that, or it becomes the new default, if it can become the new default. Not just in the room, though, right? We want carryover and maintenance into real life. So when the person is ready, we want goals for how do you actually try the voice out, and we often name the voice: new voice, my voice, best voice. And how do we do that in particular situations? It might be just good morning. It might be a full disclosure with somebody and say, I'm going to practice my voice now. What do you think? Or you don't, or you establish rules. I don't want any feedback. It's about mindfulness and noticing your voice as you're talking. I often say it's kind of like when you're public speaking and you have this kind of eye on yourself while you're trying to make sense. Am I making sense? Okay. It's about resetting the voice. If it starts pulling back to the baseline, how to reset. Often, there might be a client who isn't really ready for anything, but they feel like they're going to be ready, but they need a little bit of extra support. I'm in the financial district of New York. We'll walk outside my therapy room. We'll walk around the block on the busy streets of New York and just have a conversation and have this feeling of, okay, I'm in public, but we're doing the same thing. Or we'll go they have to buy a coffee with me standing next to them. Then we go back to my office. So things like that. Speech therapists are really creative, and there are many people that have even better ideas than that. Not just techniques even, not the techniques in the office, not the techniques that you use outside the office. It's the thinking part that makes so much of a difference. How are your feelings about your voice as it's changing? How are you feeling about using it in real life? What kinds of ways can you be assertive that you haven't been assertive before? Let's see. Okay. The length of voice training can be, boy, it really depends, but it's often 6 to 12 weekly sessions, and then less often, follow up through a year. It's much less if a person is on T, maybe even just 3 sessions. With surgery, it is less as well. Okay, when referring, when do you refer, or who is a candidate? Basically, somebody who's dissatisfied with voice and communication, or somebody who's even curious about voice and communication. They don't have to even be presenting. They could be working on their voice privately. Any time is okay, earlier is better. Find a clinically and culturally competent speech pathologist in your area. If you don't know one, contact me and I'll try to help you. Oh boy. How much does it cost, and is it covered? Some insurances cover it, and having voice included in a letter of medical necessity for gender dysphoria is very useful. That is done by most of you and not by the speech therapist. It's by somebody who diagnoses gender dysphoria, and speech therapists don't do that. We diagnose voice and communication issues. How do you decide, how is it decided by the client whether to do training, testosterone, phonosurgery, or a combo? Again, speech pathologist is the key. It's not about gatekeeping, it's about allowing somebody to make an informed decision, to help them understand all of the possible things they can do with their voice, and then decide how much or how little to do. There are many issues that come into play when it comes to deciding, especially between phonosurgery and training. Access, commitment, reversibility, all of these things are very important, and the speech pathologists, it's our job to be helping through that. 4 minutes. Okay. I want to say just a little bit about coordinating with HRT providers, with phonosurgeons, and mental health. So if you're an HRT provider, please provide some basic information about voice, just that you know testosterone reduces pitch and that there are variable effects. And then you can feel free to leave it up to the voice therapist to fill in the blanks and how that could really affect that person. We also talk about professional voice issues, how smoking affects the voice, how binding affects the voice, etc., and tracking voice changes over time. A lot of people do that on their own, but having a professional help them with that can be a more useful experience. A lot of times what happens is I'll see somebody much later in the process where they've taken T and they have dysphonia or continued dissatisfaction, and they're surprised and disappointed. And I really hope that what I'm telling you today will help reduce that situation. With mental health, my main point here is to help you understand that voice therapists, we talk about feelings around voice. That's in our scope of practice. It's important to talk about the voice change processes, how somebody is managing taking a risk. Somebody might come and say, oh, I'm practicing, yes, 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 and oh, the goal was to say hello to your roommate this week. Did you do that? No. And then we're at a point, we're at a barrier about taking a risk. Those things are a very important part of the process. Accepting the best possible voice. Accepting the best possible voice is very much linked to accepting the self. Issues like worrying about sounding natural, where they'll hear a recording of their changed voice and like it, but in their head, it really sounds way too over the top, or maybe not enough. And that can be linked to worries, or that could be linked to just the neurologic process of the voice or the body being used to the old way of hearing oneself. So vocal awareness and understanding that process is such a important part of what we do. Another issue is discussing misgendered moments around voice. Again, being assertive. We are the place to practice speaking up for oneself. And coordinating with the psychotherapist. You may have come up with a great strategy or a great phrase to use, a mental strategy or something you say in a particular situation, and then they practice it with me. In terms of phonosurgery, 2 more slides. Thank you. They're good slides, he said. Okay, with phonosurgery, laryngologists and speech pathologists regularly work together. And so whenever there's voice surgery, the speech pathologist is usually doing rehab before and after. When it comes to gender, it's really important, again, for the speech pathologist to be the one to take the time and discuss what to expect and what not to expect. The recommendation, as I mentioned, is training and then do surgery with it or not. But there are some people who really prefer to just do surgery, and that is completely fine. It's very important for the speech pathologist to just give them that option of knowing all of their options, and then they decide. So sometimes a client will come and want to maximize all of their options and get as far as they can with training, and just want that peace of mind, even if they've met their goals and are doing well and not being misgendered and they like the way they sound, still have the phonosurgery for peace of mind that they're never going to go down in the dungeon with their pitch. So, takeaway, please help us increase access to voice care. Please provide basic information. Take a look at my slides when you go home, and please avoid the myths. Voice is not superficial. It's not about promoting stereotypes. It's not only about pitch, and it's not just for people whose goal is to be more feminine perceived. So find the speech therapist in your area. Please send even just for one assessment for the client to know how to go forward. And and I think all of this coordination is going to improve the quality of care. Thank you.